Typically I would be skin to skin. I wouldn't be, through t-shirt and dress shirt and vest, but if you sit your patient up real tall and you ask them, go ahead and turn left and then turn right. So can you already feel like you've got less rotation coming this way than you have going that way? Turn left again. Turn right.
Stiffness to the right.
Stiffness this way? Okay. Okay. So again, the spinous process is going to be moving to the left when you turn to the right. Okay. So the idea here, we're going to localize C7, T1. I usually like to just do a first rib depression. There's T1, so I can localize C7 and get a really nice block. I never block right on the spinous process. It's just too uncomfortable. I come out laterally a little bit. I get some tissue, and then I push up into the spinous process, so you get a little bit of a pad. Okay. You're going to slacken your patient's upper trap, levator, kind of their entire upper quadrant on the side that you're going to mobilize. And then you're going to just gently ask them to rotate, stop until you feel the initial motion at C7, C6, wherever you might want to be. I'm at C7 for instructional purposes. And then you're going to side bend them down there until you feel the first motion. Because remember, mobilization, particularly HVLA techniques, need to be done mid-range, not end range. They're just way too uncomfortable at end range, particularly in the neck. Patients hate when you get them to end range. Zygomatic arch, and then what you're going to do is you're going to use adduction, abduction of your femur, of your thigh, to create the motion for the patient and to create what I'll call final minor adjustments. I'm looking for where you're most restricted. So you're already rotated, you're already side bent, okay? And the manipulation, permission to proceed, okay, is there. And it's not any more rotation, it's my vector is that way. Yeah, so it's more of a traction manip rather than a over rotation manip. And the control of your body with the adduction, abduction of the thigh at all. This is all super relaxed and just feeling. Okay, and then those minor final adjustments, that's where I feel the direction of most restriction. Because in one slight area you felt really, really mobile, and then I turned you just a little bit, oh my God, there's a lot more stiffness there. So I'm looking for which direction exactly am I gonna thrust? Where's my vector gonna be? Because that's where you're most restricted, and everybody's gonna be a little bit different. There's no two bodies created equal in all my years of practice.
I've been playing around like 2 techniques for HVLA. I don't really do them, but I have been. So I'll do the towel roll, the seated one where I just kind of like thrust up. Or can I show you the one I did with her?
Sure. It's not prone, is it?
No, it's supine.
Okay. No, for sure. You're talking about side bend, rotation, thrust.
Yeah.
Down glide. Yeah, I know which one you did. So if you're going to do an opening HVLA technique, your primary lever is going to be rotation. Secondary lever is side bend. If you're going to do a closing or down glide manipulation, your primary lever is going to be side bend, and your secondary lever will be rotation.
Yeah, so when I first assessed her, she was a little restricted here, but when I moved to here, that's all she had.
Yeah.
So from here, I just went like, I just thrusted, and then from this side,
Thank you.
But she had good motion that way.
Yeah.
So is that a bad technique?
No.
Okay,
No.
Just different options?
Just that was more mid-cervical, right?
Okay, yeah.
C5, C4-5. Mine was much more lower cervical, CT junction, and I decided that because of the nature of her. She essentially didn't have a lordotic, CT junction. It was already really kyphotic. She had a nice step off down at her base, C-spine base, and so she's not mobile there, and you can see that just from assessing her posture. And then all of her symptoms were low, low, low. She was not pointing at all up in here. It was low, low, low. And then I asked if she had any scapular girdle pain, and she kind of pointed to a distribution that would correspond with C6, C7 facet joint. So I decided to go lower, just based on where her symptomatology was.
Do you have time for a quick? Can I just try the one that you showed me?
Yeah, go ahead.
Sure.
No, it's okay. It's okay. We got to be in Carmel Valley at 3 o'clock for a flag football game.
So when you're looking at rotation at C6 or C7, right? Lower cervical?
Right, so take your thumb to the lateral aspect of my spinous process, and when I turn, you'll feel my spinous process come right into your thumb. Okay, so back off a little bit, take some tissue, now jam it right into this SP, and now when I try to turn, you'll feel how stiff and locked it is. Okay, so keep that block there, okay, and then you can take your hand on top of the patient's head, or you can ask them to actively rotate, and the second you're losing it, really hold that block. The second you feel that spinous process come into your thumb, stop.
Right there?
Yep, now start to side bend me, and the second you feel movement, stop. There.
Are we going on
End range.
45 degree, or are we going this way?
So first rotation and then side bend.
Okay, so gotcha.
There. And then
And this is your plane of motion if you're going to
yes, and you get your thigh in tight. There you go. So I can totally relax. Perfect. And then this hand needs to drop down to my zygomatic arch on my cheek, and you're super tight. You're tight so that I'm completely relaxed. And there's very little slack in the system between your body and my body. And hand here, there you go. And minor final adjustments. And remember, you got to be toward the lock before you thrust. And the thrust is tiny, otherwise you're going to tear my muscles.
You mind if I try?
No, no, please.
You change your hand position as soon as you get to the position you want.
Yes.
Okay.
Yeah.
I'm losing this.
Yeah,
Sorry
good
about
solid
this.
block. No, it's fine. You're
Sorry
good.
if I messed up your hair.
All good. That's what water in the sink are for. Tighten down. There you go. There. Now I can relax.
Am I too much motion with my leg?
No, that's just for you. That's not for me. That's for you to find your infield.
Ready?
Yeah. Yeah, you got it. Yeah, you got it. That was good. You got it. And I felt totally relaxed and totally secured the whole time.
Gotta practice.
Yeah. No, that was good.
Thank you.
Sure.